Welcome back, friends, again. So in the previous two video lecture we have discussed about the introductory part of the Haemophilus influenza, which is the topic of our first video, and then in the next video we have talked about the virulence factors present in influenza, that is Haemophilus influenza, right? So now in this video we will going to discuss about which type of bacteria causes more invasive disease and what is the reason behind this, and which type causes more less invasive disease. Okay, remember it very carefully that in encapsulated strain only the B strain have the ability to cause disease, and the non-typable or non-encapsulated strain have the ability to cause disease, right? So let's start. So first I want to told you that in encapsulated strain, as it have the capsule layer, they are capable of doing invasive disease or causing invasive disease. Okay, so how they are doing this, let's see. So first of all, it will spread from the nasopharynx to the epiglottis, causing epiglottitis. Okay, remember it very carefully. After destroying the IgA, the first in both the cases, that is in encapsulated and our non-encapsulated, the first place for bacteria to reside is the nasopharynx. Okay, from that nasopharynx they will transfer, so they can directly spread to the epiglottis causing epiglottitis, or to the soft tissue of the skin in the face causing cellulitis. Okay, so that is the two thing, and also they have the ability to breach through the epithelium cells of the nasopharynx, and they have the ability to invade the blood capillaries and enter the blood, and in the blood they causes bacteremia. Okay, and as they have now in the bacteremia in the blood, that means it is obvious that they can be transported to any of the important organs, right? So if it can transfer to the meninges, it will causes meningitis. In case of bone, it will causes osteomyelitis, and in case of joint, it will causes septic arthritis. Okay, so that is the type of situation that can be caused by encapsulated strain. So again, in encapsulated strain, as it is a more invasive bacteria, the design behind this is the presence of the capsule. Okay, so these more invasive bacteria have the ability to directly spread to the epiglottis causing epiglottitis, or they may transfer to the thin skin tissues, the soft skin tissues in the face causing cellulitis, and they can also breach through the epithelial cells of the nasopharynx, okay, and invade the blood capillaries and enter in the blood. Okay, in the blood they will cause bacteremia. Okay, and as now they are in the blood, it is obvious that they can transfer to any important part of our body. For example, they can transfer to meninges causing meningitis, they can transfer to bone causing osteomyelitis, they can transfer to joint causing septic arthritis. Okay, so that is the idea. So now it's time for non-encapsulated strain. So as it lacks the capsule, so it does not have the ability to causing more invasive disease. Okay, so it causes only some mucosal infection, okay, by direct extension. So now they may reach the eustachian tube, and then they may reach the middle ear and causing otitis media. Okay, that is the important situation caused by non-encapsulated influenza. Okay, and it can also transfer to the paranasal sinus, where they causes sinusitis. Also they can transfer to the respiratory tract, okay, if they go down. Okay, so they can transfer to the respiratory tract, there they can cause bronchitis, that is the inflammation of the bronchi. Okay, and they can also cause pneumonia, that is the inflammation of the lung. Okay, so that means here three complications can be created with the help of non-encapsulated influenza, right? So non-encapsulated influenza causes the otitis media, okay, by go up to the eustachian tube and then to the middle ear, and it can also spread or transfer to the paranasal sinus, where it causes sinusitis. Okay, and also it can go down to the respiratory tract where they can causes bronchitis, that is the inflammation of the bronchi, and they can also causes pneumonia, which is the inflammation of the lung. Okay, so that is the idea. So in first cases we have seen about the encapsulated strain. This encapsulated strain have the ability to cause more invasive disease due to the presence of capsule. Okay, they can spread to the epiglottis causing epiglottitis. They can spread to the smooth skin tissues of faces causing cellulitis, and they can also breach through the epithelial cells of the nasopharynx and invade the blood capillaries, and enter the blood, and in the blood the presence of bacteria is known as bacteremia. That means they are causing bacteremia. Okay, now as they are in bacteremia from, that means as they are in blood, there is a high chance that they can be transferred to various important organs. For example, they can transfer to meninges causing meningitis, they can transfer to bone causing osteomyelitis, they can transfer to joint causing what? Septic arthritis. Okay, so in non-encapsulated part, the bacteria are only causing mucosal infection by direct extension. They may go up to the eustachian tube, and then by reaching the middle ear, it can cause otitis media. They can also transfer to the paranasal sinus, where it is causing sinusitis. Okay, very important. And it can also go down to the respiratory tract, and in the respiratory tract it can cause bronchitis, that is the inflammation of the bronchi, and it can also cause pneumonia, that is the inflammation of the lung. Okay, so now non-encapsulated, this is the two important MCQ, that non-encapsulated strain have the ability to colonize 40 to 80% of the nasopharynx of the child. Okay, and also adult. Okay, so encapsulated strain have the ability to colonize the nasopharynx of 3 to 5% of the children of age 2 to 5 years. Okay, so another important thing that I have to mention in the second video, but I have incorporated here, that Haemophilus influenza is transmitted via respiratory secretions and respiratory droplets. Okay, so that is the idea of how it gets transmitted. Okay, and it is easy to understand because here we have discussed in our previous videos that it is a respiratory disease causing bacteria, right? So the respiratory secretion and respiratory droplets will be the mode of transmission. It is nothing new, right? So that is for all about today's video. So today we have discussed that encapsulated bacteria causing more invasive disease. They can cause cellulitis, they can cause our epiglottitis, and they can also cause bacteremia, and they can cause meningitis, they can cause osteomyelitis, they can cause septic arthritis, right? And in non-encapsulated strain, they can cause otitis media, they can cause your sinusitis, they can cause bronchitis and pneumonia, right? So in next video we will going to discuss about the risk factors associated with Haemophilus influenza. So till then, bye bye.